Good afternoon, everyone. We're thrilled to welcome you all to another inspirational and educational episode of Concorde Conversations. Concorde Conversations is an initiative by Concorde Medical Group to educate, empower, and encourage our community about our health so we can all live to our fullest potential. Today's episode is Healing Hearts, a recovery journey from heart failure. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program at Concorde Medical Group in Northwell Health. And today we're joined by our renowned colleagues from Northwell Health. I would like to introduce you all to Dr. Andrea Berger and Dr. Aeshita Dwivedi. Both are board-certified cardiologists. Many in our community have submitted amazing questions for our experts today. So if you have any additional questions, please ask them in the chat box. Remember, we only have 30 minutes together, so we're going to go through as much as we can. If you have a particular question about your health, we'd like to help you. So come and talk to one of our exceptional Northwell physicians about your health so we can answer your questions. So let's get started. Dr. Berger, the difference between heart failure or a heart attack and a heart attack?
First of all, I want to say thank you to everyone for having the bravery to come to a talk on heart failure. And I want to say that our goal is really to turn what can be a serious diagnosis into success. There are a lot of new treatments for heart failure, both medications, interventions, devices, and a lot of different things. So it's not as grim as perhaps it once was. And just because you're diagnosed with heart failure one time doesn't mean that you have heart failure for the rest of your life. It's something that you can go in and out of. It's kind of a dynamic diagnosis. But to start it out, heart failure is a constellation of symptoms that result from the heart being unable to supply adequate blood flow to the tissues. It's primarily due to either a pumping problem or to a filling problem. Sometimes the heart is kind of like a balloon where you're trying to blow up that balloon and you can get the first part to be blown up, but the last little part you can't. So the heart gets stiff, and both the pumping problem and the filling problem can essentially result in a plumbing problem where basically everything backs up. It backs up into the lungs, it backs up into the belly, the blood backs up into your legs. And that's where you get the cardinal symptoms of congestive heart failure that define the syndrome. I mean, people frequently, understandably so, confuse heart attack and heart failure. Heart attack is due to an abrupt decrease in blood flow to the heart muscle that causes decreased blood flow to the heart muscle and can cause death of the heart muscle, death and weakness of the heart muscle. And weakness is one of the major causes for pumping problems and for the development of congestive heart failure, but they're not synonymous.
Dr. Dwivedi, what are common signs and symptoms of heart failure? And what are red flags? When should someone go immediately to see their physician?
Like Dr. Berger mentioned, heart failure basically is when the heart is not able to pump enough blood forward, so the blood gets backed up. So it usually gets backed up in the lungs, so that can cause trouble breathing, excessive fatigue, or inability to do the physical activity that you normally did. It can also get backed up into other areas where the gravity acts commonly, like your feet, so swelling of your feet, or your lower back. Sometimes water can hide there as well. And then patients who have excessive difficulty breathing even at rest or are feeling dizzy or lightheaded, they should seek medical assistance more urgently.
Dr. Berger, what are risk factors for developing heart failure?
So there are a lot of common cardiac conditions and non-cardiac conditions which can predispose people to congestive heart failure. Conditions we deal with every day, such as high blood pressure, blockages of the arteries, and problems with the valve, all lead to the end result of can all lead to the end result of congestive heart failure. Also, there are some direct toxins to the heart, such as alcohol, classically some chemotherapy agents. There are familial heart cardiomyopathies, which is heart muscle weakness, and also viral infections is another common cause of the development of heart muscle weakness, which can lead to the syndrome of congestive heart failure.
How do we diagnose it? What tests do we use to diagnose it?
The underlying cornerstone of diagnosing heart failure is echocardiography, which is ultrasonography of the heart. It's the same technology that we use to look at babies in the belly. That basically helps us to look at the size of the heart, the function of the heart, if it's beating enough blood to the rest of your body, if it's too stiff, like Dr. Berger mentioned. It also gives us other important information like what the heart valves look like, which can sometimes contribute to heart failure, and also helps us estimate pressures in the lungs, similar to how we measure blood pressure in your arm, which is another corroborating finding of the heart failure syndrome. Other tests that your doctor will probably like to perform in order to diagnose and also figure out the cause of heart failure are common blood tests like your iron studies, thyroid function. And then oftentimes we also need to look for any plaque buildup or blockages in the arteries of your heart, which supply blood to the heart so it can pump properly. And that can be done in two different ways. One is an invasive angiogram, which involves doing a procedure, putting a catheter up to the heart. And the other is a non-invasive way, which is doing a CAT scan of the heart to look for any blockages or plaque buildup.
And that's where your expertise comes in for us, right?
Yes.
With CAT
Yes.
scans. Okay, Dr. Berger, what is an ejection fraction? We talk about it all the time, but what does that mean?
An ejection fraction is basically just a ratio, a percentage of how much blood that is filled into the heart is pumped out with each heartbeat. A normal ejection fraction is not 100%. So people always say, oh, I'm only 30%, I should be 100%. A normal ejection fraction is greater than 55%. Greater 50 to 55% we call low normal. Below 40% we say mild, and it's left ventricular dysfunction is what we say, dysfunction of the pumping ability. And below 30 we call severe. And in the 30 to 40% range, we call moderate. But again, all of these numbers are, subject to different assessments by different modalities of imaging. And also it's not a static number. They can change with treatment. So that's what we hope to do, is take your ejection fraction from a low number and improve it to a better number.
What are the different types of heart failure?
Heart failure can be because, like we alluded to in the beginning of the talk, either your heart is not pumping enough, meaning the pumping action of the heart has reduced. That's called heart failure with reduced ejection fraction, meaning a low number for the ejection fraction. The other end of the spectrum is that when your heart beats, it also has to relax to accept more blood. So sometimes when the heart gets very stiff and it doesn't relax properly, it cannot accept more blood coming into it, and then the blood backs up. That's called heart failure with preserved ejection fraction, meaning your ejection fraction number that Dr. Berger talked about is normal, but your heart is not filling adequately. And both of these have some overlapping reasons, some non-overlapping reasons. So it really depends on what the workup shows.
What role does family history play in the development of heart failure?
It is an important, familial cardiomyopathies are certainly not the most common. And again, cardiomyopathy means heart muscle weakness. If you see a lot of first-degree relatives developing congestive heart failure, then I think it's reasonable to look for a familial cardiomyopathy. There are over 20 genes involved in the development of cardiomyopathy. Most of them are genetic defects in the contractile proteins of the heart. But I think, looking for trends in families, certainly with a history of sudden cardiac death or the need for advanced therapies for heart failure, that should certainly be a clue that other family members should be screened.
Dr. Dwivedi, when do you order genetic testing for patients?
Genetic testing is typically reserved for patients in whom the initial workup and testing doesn't show a cause. And oftentimes, if you do have family history of heart failure, then that's sometimes a trigger to also get genetic testing. I will say that it's not a perfect test. First of all, we don't understand all the genes that contribute to heart failure. And second of all, sometimes you may be positive for a gene that is sort of in the gray zone of whether it can cause heart failure or not. So typically you want to see a genetic counselor, someone who's an expert in really identifying and also interpreting the genetic tests. And sometimes it can also be helpful because if we do identify one particular gene, then the rest of your family members can actually be screened for that. And if you plan to have kids in the future, it can also be helpful in that case. But I would say it's reserved for really rather less or rare cases than the common ones.
Okay, Dr. Berger, let's switch modes a little bit. Let's talk about treatment now. Can you tell us about the medications that we commonly use and what are their potential side effects?
Okay, the two most, the two most important medications for the treatment of congestive heart failure are two classes of medications called beta blockers and angiotensin receptor blockers and ACE inhibitors. Both of these medications, both the classes of medications decrease the work of the heart and also what we call afterload reduce the heart, which means, again, decreasing the work of the heart. So both of these classes of medications do decrease your blood pressure. And I always sort of describe the heart as here and the blood pressure coming out of the heart. So if the blood pressure is coming out of the heart, I always say it's sort of like when you're stepping on a garden hose. It makes the heart have to work harder to eject the blood out. Whereas if you relieve the tension and the pressure on the garden hose, the heart is able to pump out easier. So beta blockers and angiotensin receptor blockers both cause remodeling of the heart. The biggest side effects of beta blockers, some people experience fatigue. Some people have something called chronotropic incompetence, which means it's a fancy word, which basically means that when you do your exercise, your heart rate doesn't increase appropriately. Some people don't like the way that they feel when exercising on beta blockers. Unfortunately, they have the unwanted side effects sometimes of erectile dysfunction and depression. Those are always things that we have to deal with, but most people are, concerned about their heart enough that they want to be on a beta blocker because it is one of the most important medications. Angiotensin receptor blockers, and ACE inhibitors, the biggest concern is kidney dysfunction and elevation of your potassium. There is a rare potential side effect called angioedema, where you basically get throat and mouth swelling and inability to breathe properly. If you have that, it's an absolute, you cannot take that class of medications because that can be life-threatening. There's a new combination medicine. They call them ARNIs, or basically they are angiotensin receptor blockers combined with another medication, which is a fancy word, which calls neprilysin inhibitors, which basically means that you are increasing a substance which causes constriction of the blood vessels, which goes back to what I said. Just if you remember one thing from this talk, dilation is good, constriction is bad. So we want the vessels to be healthy, to be able to expand. We don't want them constricted because that places more stress on the heart.
And then there's also the new kids on the block, which is the SGLT2 inhibitors. I think there's sometimes patients may have seen commercials of Farxiga or Jardiance. These are the newest medications that have been added to our armamentarium of heart failure treatment. They basically work on these channels called sodium channels in your body and help the heart, the kidney, and also prevent hospitalizations from heart failure.
And according to the commercials, they help you dance.
Yes.
All right. Okay, Dr. Dwivedi, when do you refer for cardiac catheterization?
Yeah, so like we had mentioned earlier in the talk, the first thing when a patient has heart failure is to figure out why they have heart failure. And if we find a reversible cause, then it's easy to reverse the heart failure as well. So one of the common causes of heart failure is because it's not getting enough blood, which is blockages in the blood vessels. So if we are concerned about that, we can refer patients for cardiac catheterization so that we can open up their blockages, restore blood supply to the heart, and then improve their heart function.
Dr. Berger, when do we refer to the electrophysiologist for an ICD or a shock box?
Generally, when your ejection fraction is in the moderate range, an ejection fraction less than 35%, with either due to blockages of the arteries or another cause, and some symptoms of heart failure.
What about alcohol consumption? How can that affect heart failure, and how much should a patient limit their alcohol intake?
Yeah, so alcohol is can be a direct toxin to the heart, as well as obviously other organs of the body like your liver and your brain. So excess alcohol consumption is considered by the American Heart Association to be more than 1 drink per day for women and 2 for men. So anything in excess of that, you have a potential of impacting not just the heart function, but also the rhythm of the heart. Oftentimes, an arrhythmia called atrial fibrillation can also occur, which can then in turn give rise to heart failure. So everything's kind of interlinked to each other. And patients who do have heart failure, we often recommend completely abstaining or limiting the alcohol use because it does put more stress on the heart.
Can heart failure be reversed or cured with treatment, or is it a lifelong condition?
So again, going back to what Dr. Dwivedi just said, the etiology of your heart failure determines in large part whether it can be reversed. If you have heart failure due to uncontrolled high blood pressure, frequently, if you control your blood pressure, the heart function will improve. Similarly, if you have heart muscle dysfunction from alcohol, you stop drinking, your heart function can recover. Similarly, when you have blockages of the arteries causing heart muscle weakness, you revascularize and the heart function will improve. So all those things. Sometimes arrhythmias, if they're treated, the heart function can improve. Um, viral causes can frequently improve. So a lot of times with the acute causes of congestive heart failure or heart muscle weakness, it's kind of a rule of a third. A third will stay the same, a third will get better, and a third will get worse.
And then just to add to that, I think the earlier it's diagnosed, the better the outcome. So hence the importance of seeking care earlier, because that's when we can help the heart the most.
So there is hope.
Yes.
So what can we do to prevent heart failure, Dr. Dwivedi?
Just identifying the risk factors that contribute to heart failure, like high blood pressure, diabetes, kidney disease. These are the common risk factors. Also, if you have family history of heart disease, go in early, get yourself checked out. And then also, just listen to your body. If something doesn't feel right, don't chalk it up to just, oh, I'm just getting old. I used to be able to climb a flight of stairs, but now maybe I'm just old. I think, it's important to get your symptoms checked out if your body doesn't feel right, because the earlier we diagnose it, the more options we have to treat it.
Great. Okay, so Dr. Berger, what causes worsening of a person's heart failure, worsening of their heart function?
So as I said at the beginning of the talk, people can go in and out of heart failure, and there's certain things which can cause what we call an exacerbation of heart failure. Anything that stresses the heart can essentially cause congestive heart failure, which include rhythm abnormalities, high blood pressure, ischemia, which is the heart muscle not getting enough oxygen, any pulmonary infection can stress the heart, rhythm abnormalities, I guess I already said that. Medications, classically non-steroidal anti-inflammatories, which cause salt retention, can certainly precipitate congestive heart failure and volume overload. And medication and dietary noncompliance is a huge one. People just suddenly not taking their Lasix or running out of their Lasix, or, or basically they had, Christmas dinner or lox or a bunch of crackers the night before. This frequently happens. People have a huge salt load, and that can certainly cause a decompensation even the next day.
So what is an NSAID? You mentioned that during your talk. What is that?
Non-steroidal anti-inflammatory medications like Aleve, Motrin, naproxen, all of that class of medications. As one of their side effects, they do increase sodium reabsorption.
So if you have a headache, Tylenol is probably the best.
Correct.
Okay, Dr. Dwivedi, we commonly tell patients to weigh themselves every day. Why do we have them do that? And what is your dry weight?
Your dry weight is a number that your doctor will give you where your body is functioning optimally and your heart is able to pump the blood optimally, because it's not working against too much water retention in the body. So when we gain or lose weight suddenly over a period of 24 to 48 hours, that's typically water weight, because your body doesn't gain or lose fat that fast. So if your weight goes up by more than 3 pounds or 1 kilo in a day, that usually means that you're retaining more water in your body. So it's important to weigh yourself every day so you can check the water retention, because the earlier you diagnose the water retention, your doctor can increase your medications, specifically your diuretics, so that you can get rid of the water retention. And the early diagnosis also helps prevent hospitalizations, because once you get too much water retention, then the medications stop working as well, and you oftentimes have to go into the hospital to take that water off. So it's really important to weigh yourself typically in the morning every day, or at least at the same time every day, and monitor your weight.
How do we support someone we care about with heart failure?
I think just encouraging them to be aware of the symptoms before they get too advanced or out of control. I always want to deal with things before they need a hospitalization. So, whenever they should be aware of the cardinal symptoms, such as swelling of your legs, the weight going up. They should encourage their loved one to be compliant with their medications, especially the diuretics, which are for symptoms. And just to identify things before they got out of control, come see your cardiologist sooner rather than later, so we can deal with it in the office, because frequently when we deal with it in the office, we can just adjust your oral medications. If you wait too long, however, you need intravenous medications to turn you around.
So pay attention to your symptoms and react. Okay, last question. If you had one action step to recommend to our viewers to improve their health and start today, what would it be? Dr. Dwivedi, do you want to start?
Sure. I would say just identify your health risks for any condition, including heart disease. Heart disease specifically is often silent until it's not. And I think visiting your doctor earlier rather than later, treating the risk factors for heart disease can prevent heart disease and also help to live a longer, healthier life.
I'm going to say move more, because exercise, we talked about healthy blood vessels, and exercise leads to healthy blood vessels, and healthy blood vessels both prevent heart failure and make you feel better and live longer when you develop heart failure.
Well, thank you all for joining us for another inspirational and educational episode of Concorde Conversations. A very special thank you to our guests, Dr. Dwivedi and Dr. Berger, for joining our conversation. We appreciate their expertise to educate, encourage, and empower our community. And as part of our community, we hope you share in our mission. Please pass along our emails and webinar links to help everyone live to their fullest potential. In addition, please subscribe to our YouTube channel. We know you have additional questions about your health, and we want to help you. So come in and speak to our extraordinary Northwell physicians about your health. We care about your health. We care about you. Thank you so much for joining.